Okay. So I am recording this call so that I can send it to you all afterwards in case you want to refer back to it later or pass it along to a friend. I'll have the recording. Feel free to forward it on to other people. If you aren't comfortable being recorded, it's okay to just listen. You can totally just observe. Stay off audio, stay off video. Totally up to you if you want to dive in on the chat. You can always follow up with me afterwards for more questions. We can always discuss offline. Otherwise, as long as you're comfortable, please participate in the way that feels comfortable to you. So I'll just share a little bit about me as we're diving in. So I'm based in the San Francisco Bay Area. I'm a mom to a 16-month-old, and I'm currently a student at the International Doula Institute. So it's through them that I trained to become a childbirth educator, and I'm in the process of training right now to become a doula. So I'm going to be a labor doula and a postpartum doula as well. Hopefully by the end of the summer is the plan. We'll see how this impacts that, but it's super exciting. So I'm the daughter of a NICU nurse, which might lead you to believe that I always knew this is what I wanted to do. But I actually didn't know how passionate I was about about childbirth and parenting and helping others through this transition until I went through it myself. And once I got to the other side, I kind of realized that this is something that really matters a lot to me and that I am really passionate about, and I'm thrilled to help others through this experience. So a couple people planning to write birth plans, a couple people not planning to write birth plans. Let's take a level set at kind of what they are, why I think everyone should write them, and how do you even use them. So I like to use the term birth preferences instead of birth plans, just because the simple change from plan to preference can help our mental mindset when we're going into things. When we think of a plan, it's something that we intend to happen. There's kind of more of a implied guarantee or an implied promise in that, whereas birth preferences keeps us open mentally to the idea that this is what we prefer, this is what we'd like to happen, but we know other things could happen. So just that small switch from birth plan to birth preferences, I think, can just help us to stay open and to having a more satisfying experience. So what are birth preferences? They're a communication tool that you can use to share those wishes with your care team. So you can think of it as a wish list of, these are all the things that whenever I have an option, this is how I'd like for it to go. This is what I'd like for my experience to look like and feel like. They're not a guarantee of your desired outcome. I think one thing that's difficult about birth plans, some providers aren't a big fan of birth plans because people can get really attached to that plan that they had in their mind, that vision of what I want my birth to look like, and kind of lose sight of the main goal of healthy mom, healthy baby. So the more that we can stay flexible and understanding this is what I'd like to happen, as opposed to being committed to this is what has to happen, the more that we can set ourselves up for success. So why should I write them? Just going through the act of writing them can be a really wonderful way to prepare yourself for what's to come. It just gets you to think about what are the things that could happen, what are the things that I'd like to happen. It gets you thinking about how do I cope with stress in my normal day-to-day life? How do I cope with pain? How do I like to be supported by my partner or by others in my life through times of stress or pain, or what are the things that help me relax? What are the things that make me happy? What are the things that I turn to at the end of a hard day? And so it can help you just think through those things to help you prepare for what's to come. And they're a really wonderful tool. Just writing them can help you align with your care providers. So the earlier you write them, the more you can have those conversations with your care provider. So whether that's your doctor or your midwife, your doula, even if you are choosing to have one, it just helps you to have conversations, facilitate those conversations. You're researching something, you think, oh, I wonder if that's an option for me. I wonder if that's, something that my hospital or birthing center offers, and you can have conversations about, about what you want it to look like, what it could look like, and it also gives your care provider a chance to help you to have realistic expectations. So they'll have a chance to say, here's why I don't think that's a great idea, or here's why that's a wonderful idea. What's important about being aligned with your care team around your birth preferences is for you to figure out that you're a good fit. You want to feel supported and respected by your care provider, and they don't want to have to fight with you every step of the way, right? So it's important that you guys are on the same page, that you're feeling good. And the more aligned you are, the more likely you are to be satisfied with your experience, your childbirth experience, when it's all said and done, even if it maybe didn't go 100% to plan. So when should I write them? Like I said, the earlier the better, but it's also never too late. So if you're one of the people if you're 36, 38 weeks along, you're getting close to the end and you haven't sat down and thought about this stuff, that's okay. I still recommend, at least thinking through some of it. But it's also never too early to start writing them and start having those conversations. So the best way to approach writing your birth preferences, attending a childbirth class is a wonderful place to start because it can just kind of start opening your mind up to what your options are. I think one of the things that can be difficult is that we are oftentimes throughout our pregnancy surrounded by people who have answers, but we don't always know what questions to ask. So attending a childbirth class can be a wonderful way for you to just start figuring out what are some of those options that are out there, what are some things that you maybe have never even heard of or never even considered, and using that as a starting point to go and dig deeper and do some further research. Like I said, I also highly recommend discussing them with your care provider, just discussing the things that you're researching, the things that you're learning, the things that you're seeing, so maybe around pain management, you had just heard in your birth class that there's about 3 different options and you thought there was only 1 or 2 different options, and then you wanted to dig deeper with your care provider about what those different options are, why people choose them. Maybe you did a little research and you were thinking, oh, that actually sounds like a really great option for me. Or, maybe this is a nice plan B option if I'm somebody who wants to deliver, just depend on myself to a non-medicated birth. And you feel like maybe, talking to your doctor about, oh, this sounds like a really gentle plan B. So it just kind of opens your mind up to possibilities and helps you feel really empowered too, and reassured that the decisions that you're making, the choices that you're making, the preferences that you have are truly the ones that you want. I can tell you my own story a little bit. I was a person who was very adamant about having a medicated birth. I was like, I'm going in and I'm absolutely like, I want the epidural. I want it as soon as possible. I want it as fast as possible. Like the second that we can give it to me, great. And I had intended to take more of a care provider driven approach, where I was like, you guys are the experts, like this is in your hands. So I didn't feel like I really needed to have a birth plan. I didn't really feel like I needed to write out my birth preferences letter, because in my mind, like I just wanted this really straightforward. I'm going in, so you're giving me that epidural as soon as possible. Whatever you guys need to do, see you on the other side. And it wasn't until after I had given birth to my son, and actually my epidural failed. I wasn't actually able to get an epidural, and I ended up delivering fully naturally. It wasn't really until afterwards that I stopped to think about how important it would have been to prepare for a plan B. And just starting to learn about the different things, that wasn't until after I had my son that I even thought to consider the fact that there are reasons that people choose non-medicated births that have nothing to do with, just pride or strength, but I learned a lot more about the natural physiological response and some of the benefits of delivering without medication that I'd never heard of. Not to say that one's right and one's not, but I realized that I had made a lot of passive choices that led me to wonder after the fact if I really had set myself up to have a more satisfying experience. So that's why I encourage everyone to do it. Whatever your circumstances are, whatever you want your childbirth experience to look like, just be an active participant. Know what your options are, so that you can feel really comfortable on the other side. That you were a part of your care team. You were an active participant in your childbirth experience. You were really prepared for whatever happens. So that's my level set on birth preferences. So this is kind of probably what you're all here for, right? Is how could my COVID-19 or how could my birth preferences change in response to COVID-19? So we know a couple things, right? That policies are changing every single day. We know sometimes they're changing by the hour. And there's a few different ways that our birth preferences could be impacted. So I just kind of wanted to talk through what are some of the things that you might want to start to think about while you're getting ready for this. The biggest reason that I encourage you to think about this is not to cause stress, not to cause fear, but quite the opposite. I think when we have the chance to sit down and think through what could happen, it gives us the opportunity to come up with a plan and to feel more prepared going into things, so that you know that you are ready for anything, even if there is a last-minute policy change, even if there is a last-minute option that's been taken off the table. You know that you have a plan for it. You know that you will be okay, and just have a little bit more of that confidence going into it. We'll just start at the top here and work our way around. So pain management options. One thing that I have heard is that the option to use nitrous oxide, so that's delivered through a mask for pain management, is no longer being offered at some hospitals. I think that this is less related to containment and more related to the fact that we have limited resources, and those masks are very necessary. Now, there's a ton of different pain management options out there, so if this was something that you were hoping to utilize during your birth, definitely talk to your doctor about, what's another option. Maybe you don't want to jump to having an epidural, but you want another gentle option. Just talk to your doctor. There's a few different options out there. I think as far as pain management goes, like I had mentioned earlier, it is always good to kind of have a plan B, to have a backup plan for pain management. You don't know how you're going to respond to the pain management in the moment. Like I said, I never imagined in a million years that my epidural would fail. And I wish that I had spent more time thinking through how do I want to be supported in the event that I do need to deliver without medication. So just know what your options are. Anyways, support options. This is the big one, right? This is what everyone is most afraid of. I'm not sure if you all have heard, but really exciting news is that New York City has announced, and they've gone back and they said we are allowing one person back into the delivery room. So they were the first ones to take support people away. And they're now have come out as a state and said, nope, that was wrong. We take it back. You can have a support person in the room. So there are some people who are still, some hospitals who are still sticking to the no support person policy, but it is absolutely expected that now that New York has come out and made this strong stand to change back and say, yes, one support person is allowed. There's an expectation that the rest of the country will follow suit. So that being said, one thing to consider, regardless of whether or not your hospital is allowing you to have a support person, is what if your partner gets infected. So even if your hospital is allowing for you to have a support person, probably not the best idea to have your partner there if they, and I don't know if they would be allowed to come in anyways, if they actually have contracted and have tested positive for COVID-19. This is a hard one. This is a scary one. I can understand where all of the fears come from, because this is the one thing that we never thought we would lose, right? It never crossed our mind that we would have to deliver without a support. So I want to recognize that. I want to validate that that fear is and that anxiety and that stress is absolutely valid. I also want to reassure you that you are capable, that women do this all of the time. Women who have partners who are deployed, who are incarcerated, who have been abandoned by their partners, who are homeless. Women do this, and women are capable of doing this, and you won't be completely alone. I really want to reassure you that even if your partner isn't able to be there physically, having them there, even just the emotional support that you can get virtually, will still be a really wonderful option. Every doctor, nurse, care provider that I have talked to or heard from, or joined a talk of theirs in the last couple of weeks all says the same thing. They're absolutely in full support of the virtual support. It is something that a lot of hospitals and birth centers are familiar with, because they do this all the time for military families. It happens. It's not ideal, but you're not going to be completely alone. Your nurses will be there for you. Your care provider will be there for you. You will have the support, and I promise you that they're not excited to enforce these policies either. They're not excited for this change. They know that this is disappointing, and they will have a heart for you and be there for you to support you the best way that they can. And we'll talk a little bit more on this next slide about what that looks like to prepare in the event that you do have to deliver by yourself. Visitation, we know, is a big one that's changing, so not being allowed to have additional people coming in, just that one support person. In some cases, they are still allowing a support person and a doula, but I think most hospitals and birthing centers at this point are not allowing anyone beyond that. So just know that that's likely to be true for a while still. On the flip side of that, we're also seeing length of stay changing. So the duration that you are actually staying in the hospital to recover afterwards. A lot of hospitals and birthing centers, birthing centers don't typically keep you overnight anyways. For home births, a lot of women are just attended to for a few hours afterwards, 4 to 6, sometimes longer, but typically about 4 to 6 hours afterwards. For a birthing center, you're likely to only be there for about 12 to maybe 24 hours. At a typical hospital stay, you would be there for 24 to 48 hours afterwards, and we're seeing most healthy moms and babies being discharged early, right around 24 hours. So the reassuring thing there is that if you are unfortunately having to deliver without your partner, it will be long before you are reunited back at home. Early labor is a big one to consider. I think now more than ever, it's really important to have that strategy to labor as long as possible at home before you go into the hospital or before you go into the birthing center. So really talk this one through with your care provider, your doctor or your midwife, about when is that time that I should really be going into the hospital. For the most part, it's by the time that you're getting to that point where it's really difficult to continue a conversation. You're having a contraction and you really have to stop. You're not really able to kind of ignore it anymore. You're not really able to carry on a full conversation with your partner anymore. It's really like you're having a contraction and and feeling like, ooh, okay, this is like disrupting what I'm doing right now, that's typically the time that you would want to go in. But talk to your care provider, have a strategy, so that you are limiting, you're able to stay in the comfort of your home, the security of your home as long as possible, and limiting your risk of exposure. Access to the unit. So if you are delivering in a hospital or birthing center, typically you would have some extra room to kind of free roam the unit, so to be able to walk down the halls, walk around the unit, maybe walk by the maternity ward, just to have some extra space to move while you are laboring. We're seeing that in most places you're being restricted to your room. So now that doesn't mean that you can't move around, and in many cases, especially if once you have an epidural, you're restricted to your bed. But as long as you are still laboring without pain medication, you should still have plenty of room to move around your room as you see fit, just like they won't be able to leave your room. And the last one here, laboring resources. One thing to keep in mind is that we are seeing that some resources or some options, laboring options, aren't being available right now, or aren't being made available right now. So things like birthing tubs that maybe require a little bit of extra resource, a little bit of extra support to offer. So just keep that in mind, that you might not have every resource and every option that your hospital or birthing center has available or offers. They might not all be available to you right now. This is a great one to talk to your care provider with ahead of time. Just ask them, are there any options that you typically offer that are no longer being offered right now? The thing to keep in mind with this is that most often, especially in hospitals, there's only a limited number of resources to begin with. So your hospital might have a birthing tub, but they have limited options anyways. So if there are extra things that you're planning to use, a birthing tub, like a laboring ball, anything of that sort, it is always just a good idea to have a backup option and not be totally committed to that, because it might not be available anyways, just by nature of having limited resources. So that's just something to keep in mind as you're going into your childbirth. I'll pause real quick before we jump forward. We are going to dive in. I'll just give you a quick look at strategies to cope with all of these things. But before I dive forward, I know that was a lot of information. I just want to pause real quick and check in if anyone has any questions.
There's a little icon next to everyone's name, and it's a little hand, so you can either raise your hand or you can just take yourself off of mute if you have a question.
Oh, thanks, Mackenzie. So glad this is helpful. Okay, let's dive in on coping strategies then. So before I dive in on the specifics of these, I want you to keep in mind a lot of these things, a lot of these strategies I would be recommending to you anyways, whether we were in the middle of the COVID crisis or not. So like I mentioned earlier, I love the idea of birth preferences, the terminology birth preferences over plans, because it just opens our minds to that idea that we might desire or we might require an alternate approach in the middle of our childbirth. So the first one here, research alternative pain, labor management options, and coping methods. So what this could be any number of things, right? This could be the positions that you're laboring in. What are the different positions that are out there that can help me cope with pain and that can help me go through my labor? What are the different breathing techniques that are out there that can help me cope? What are some things that I can surround myself with that can just help to encourage the production of oxytocin, that feel-good hormone that we know is so beneficial for our pain management and for labor progressing? Things like Is there music that makes me really happy that I want to surround myself with? Do I really like to be in candlelight? Does that make me feel really good? So do I want to set up some little electronic battery-powered candles around me, or do I want to put string lights up in my room? Am I really set on delivering without pain medication, but want to know what some gentle options are in case we get there, or vice versa? Am I really set on active management of my birth, but want to know, what are some non-medical ways of coping in the event that I have a really rapid labor, or have a reaction to the pain medication that I'm choosing? Just kind of, take some time to know what some of your options are on both ends of the spectrum, and the active management and the more passive physiological management. Have a plan. So like I said, take the time, write out what you want to happen, and specifically around COVID, have a plan for what happens if your care provider gets sick. What happens if your partner gets sick? What happens if policies change? What happens if, just think through some of those big what ifs that are causing you fear, and come up with a plan around them. One of the best ways to combat fear is just by knowing is what we can control in those situations, having a plan, being prepared so that we know that we will be okay in the event that something happens that's maybe out of our control. Talk these things through with your care provider, but also talk them through with your partner. So you take that time to explore with your care provider, what could happen, what are we seeing, and then talk to your partner, how do we feel about this, how will we respond to this? And talking through all of your options with your birth partner too also just helps them to feel really comfortable and really confident in knowing how to support you. Explore your self-care options and preferences. So this is a big one, I would say, for knowing how you can best support yourself in the event that you are having to deliver without the support that you originally planned for. So what I mean by explore your self-care options is know what brings you comfort when you're hurting, when you're stressed out, when you're anxious, or when you've had a long day. So know what helps to recharge you. Know if that's music that makes me feel really good. If, like I said, if that's candlelight that makes you feel good, bring those battery-powered candles with you. Know, is there a certain breathing that feels really good to you? Are you a person who really likes to hear from someone else that you're going to be okay, that you're going to be great? Are you somebody that likes to, you want a motivational sign posted up on your wall that says, you've got this, you can do this? Or are you a person who just likes to go internal, and you like to focus your attention and your energy inward to guide yourself through these things? Just exploring those different options of how you cope with your typical day-to-day stresses can help you when you're in the midst of intense contractions, coping with the pain of childbirth, or even coping with the stress of a situation if you maybe have to deviate from your planning. This next one, discuss your postpartum expectations and brainstorm support options with your partner, your support circle, and your pediatrician. I think that's one of the biggest ones right now. It's really easy for us to get hung up on what is this childbirth experience going to look like? How's my birth going to be impacted? But I think it's maybe even more important, or at least just as important, to think about that immediate postpartum period, and what are your expectations and what is support going to look like in that period. This is a really important one, I think, to discuss ahead of time, so that following your birth, you can set those expectations ahead of time with your support circle, parents, friends, family members, maybe a postpartum doula, whoever is a part of that circle of yours of support. Set expectations so everyone's aligned on the same page, and you're not having to have uncomfortable or hard conversations in those early days and weeks when you're, tired and learning your baby, learning your role as a new parent. Just set those expectations up ahead of time to make it easier for yourself. One thing that I would encourage everyone to consider, especially with COVID, is what those first 2 weeks look like. I think there's kind of two sides of the coin to look at here. If you're delivering in a hospital or a birthing center, you've been around more people than you maybe have been in the weeks before that, and might feel compelled to put yourself on self-quarantine, just in the event that maybe you did get exposed and you want to limit your exposure to other people, so you might want to just quarantine your family for that. On the flip side, too, you might just want people to stay away for those first 2 weeks because that's a vulnerable time for your baby. You want to give them an extra couple weeks to build up their immune system. Maybe you want to ask other people if they could self-quarantine themselves for the 2 weeks leading up to your birth, or maybe those first 2 weeks, so that you know that they're at limited risk of exposure. Or maybe you just decide that, for a period of time that you've worked out with your pediatrician, until your pediatrician feels like it's comfortable for you to have visitors around, maybe you just want to stick to virtual support. One thing that I really encourage everyone to do, again, whether we're in coronavirus era or not, is to have a list of support resources ready for you to go, so that you're not scrambling with a new baby to figure out who do I contact for help with X, Y, and Z. So take the time to compile that list of support resources and figure out what are some virtual options right now. So some people that I would consider would be knowing who do I turn to if I want lactation support? Who do I turn to if I need maybe just some extra mental support, coping with the baby blues, or I feel like, maybe I've got a postpartum mental disorder going on that's maybe a little bit more than the baby blues. Who am I going to turn to when I'm feeling isolated? Postpartum isolation is a very real concern. It's really easy to do. You're busy, you're tired, you're busy learning this new baby, getting adjusted to your role as a parent. You're tired. Those first few days and weeks can go by really fast, and you can wake up and realize that you're, really lacking on some social interaction. So know kind of who are some of those people that you can turn to, who makes you laugh, so that if you're in a moment where you just need someone who's going to lift you up, who's that person that you can turn to that, is a guaranteed laugh, a guaranteed feel good. Who's that person that that you can, no judgment, unapologetically call up and cry to, if you're just feeling overwhelmed. Who's maybe that mom support, that parent in your life who's been there, done that, who can kind of help encourage and coach you and support you through it. Just take some time to think through who those people are, so that it's a really easy, you don't have to do a lot of thinking with your new baby of, okay, great, I know exactly who I'm going to turn to, exactly who I'm going to go to. As far as virtual support resources go, if you need help finding anyone, I'm more than happy to help you build out that list. There's one resource in particular that I lean on quite heavily during my postpartum experience, and that was the Maven Clinic. What's really nice about them is they are a virtual clinic, so it kind of takes care of that concern of having to go out of the house and connect with people. And I connected with sleep coaches, I connected with lactation consultants, I connected with naturopathic doctor and OBGYN, a couple of different nurses, mental health therapists. They really kind of have the full spectrum of support, and it's all virtual. So I can definitely send you the link there. Actually, here, I'll just put it in the chat. Maven Clinic. They're a wonderful resource, but if you want help in finding any resources, please don't hesitate to reach out to me. I'm happy to do that. Another couple things, make sure that you are making time for movement and self-care right now, and you are taking breaks from the news and social media. Taking that time to get outside when you can, social distance, of course, but go for walks, get outside if the weather's nice, or even just, doing an easy, maybe prenatal flow, walking around your house, some gentle stretching. Make sure you're taking care of yourself physically and mentally and setting yourself up to stay healthy. And, like I said, mentally and physically going into your birth. And just try. It's so easy to get consumed in the news and the social media right now, but take breaks from that. Try not to let yourself get consumed with those what ifs. A couple of things that I want to really encourage you not to do right now is to make drastic decisions or alterations to your birth preferences. There's a lot of conversation right now, women who are planning to deliver in hospitals who are asking and wondering, should I be trying to have a home birth right now? Should I be trying to deliver in another state right now? Should I be going to another city? And I would highly encourage you not to make drastic decisions or alterations. I think something that's so important to keep in mind is just how important it is to the success of your delivery to be in a space where you feel safe and you feel calm and you feel supported. If you felt safe being in a hospital before, you're not going to suddenly feel safe being out of a hospital later. Hospitals in particular, if you're planning to deliver in a hospital and you're really worried about are beds going to be given away? Am I going to get infected while I'm in the hospital? Is my OB going to be hanging out down in ICU or in the ER between deliveries, supporting with COVID patients, and then coming up? That's just not something that you need to worry about. So the labor and delivery unit is considered a locked unit. So we already know, ahead of coronavirus that babies are need to be protected, and so that's a separate unit. We know that childbirth and delivery, childbirth is not an elective thing. So some elective nurses and doctors, in elective units, think things like ortho, general surgery, elective procedures are being repurposed or reassigned right now to support with coronavirus cases, to support in the ICUs. Your labor and delivery bed is not going to be repurposed. Labor and delivery units are not being repurposed to support coronavirus patients. As of right now, labor and delivery nurses, doctors, they're just not going to be repurposed to be supporting that because birth is going to continue to happen. It is not an elective procedure. And the hospitals are really doing anything and everything that they can. I know, like I mentioned earlier, my mom is a NICU nurse. I know in their unit they're taking temperatures every 6 hours and sending people home at the first sign of fever. It's a much safer place than you might feel inclined to believe. That first initial gut instinct of, oh no, the last place I want to be is a hospital. But the labor and delivery is really a very safe place to be. A lot of hospitals are even having separate entrances for moms and babies, and I would highly encourage you to let that fear go. Another thing that I would say is don't let guilt over stress cause you more stress. So I had a mom reach out to me recently and say, I'm stressed out over this, which is making me guilty because I know stress isn't great for my baby, and I'm stressing out about being guilty about being stressed. And it's true, we do want to try to limit our stress as much as possible while we're pregnant for the sake of our baby, for the sake of ourselves, for our own health. But don't let stress and guilt cause you more stress. Whenever you feel those feelings of stress, whenever you feel those moments of fear or anxiety or overwhelm, acknowledge them. And then focus on what you can control. Focus on what's in your control. Focus on what brings you relief and what brings you stress, and shift your mindset. Do some deep breathing, and as much as you can, just let that go. It's normal. It's natural to be a little bit stressed out about this right now. It's going to be okay. And last but not least, don't lose sight of the main goal: healthy mom and healthy baby. Like I said, I tell everyone this when we're writing our birth preferences and our birth plans. That is the main goal at the end of the day. It's not to have a perfectly orchestrated birth, but to to do everything that we can to ensure that mom and baby are both healthy on the other side. And that holds true during COVID-19 right now too. I think, some of the changes that are happening and the policy changes that are being put in place are hard decisions for everyone to make. They're difficult things to grasp, and it's very difficult to let go of some of our preferences sometimes. But remember that the goal in all of this is a healthy mom and a healthy baby, and just try your best not to lose sight of that. And remember that no matter how your baby comes into the world, what those first 24 hours look like does not dictate your ability to be a good parent, to be a good mom. It has no bearing over, what kind of mom you're going to be, So know that you've got a lot of time with your babies, right? You've got their whole lives to bond and to connect. So many amazing milestones to look forward to once we get through this birth. This is just a very small snapshot in our journey as parents. And keep that in mind and try to keep that perspective as we're going through that, through this experience. It's still going to be just as amazing for your friends and your family to meet your baby when they're 2 weeks old or a month old or maybe even just 2 days old, whatever that looks like. Again, doesn't mean that it's not hard to let go of some of these things that we originally envisioned, these original preferences that we had, these original visions for our childbirth experience. But I really firmly believe it's going to be okay. You're strong, you are capable, in those first 24 hours. Your childbirth does not dictate the type of parent that you'll be. So we are 10:48 here in California. I am happy to stick around for as long as you all would like for any questions that you all have. I went a little bit longer. I promised 30 minutes of content, and we went a little bit longer than that. But I'm here and happy to answer any questions that you all have. Just a quick note in case you do want to dive off. We are going to, there's a million ways that you can connect with me. I'll send a follow-up email with all of this. And I am going to host another live discussion next week with a friend of mine, Renee Thompson, who's a licensed professional counselor, and we're going to talk more specifically about coping with stress strategies for dealing with stress, whether you're pregnant to a child in the womb or through into toddlerhood and beyond. Would love to have you if you're interested in that. Like I said, I'll send out an email after this anyways with information on how to connect with me. But I'm here. If anyone has any questions, I'd love to chat with you. Deborah, to your question, I did not realize epidurals can fail. What are the reasons for that? And can waiting a long time to go to the hospital until you can't have a conversation make it so you can't have an epidural? So a couple things here, Deborah, that there is a period of time where it can be too late to have your epidural, absolutely. So there's a window. They don't want to give it to you too early and they don't want to give it to you too late so that it doesn't have time to kick in before you're delivering that baby. So that is a part of it. Waiting a long time to go to the hospital and waiting until you can't have a conversation to go to the hospital, that's just kind of typically the sign that I'm moving into active labor. Rapid labor is considered labor that occurs in 3 hours or less. This is one that I would highly encourage you to talk with your doctor about, just to see, what do they think, in particular with, with your medical history, with your experience, with what they know about you and how your birth is progressing. They might be able to give you some indication of how you're going to progress and, signs they specifically want you to think about. Some things they'll take into consideration is how far away you live from the hospital. But typically that's that good moment of knowing that, okay, I'm starting to move towards active labor. I'm likely progressed enough that I can be admitted. Because if you aren't really at that point yet where, you can kind of ignore your contractions, more often than not, that's a good indicator that you're still within that really early labor. And you're likely to you're going to be turned away from the hospital. Now, that's not the case for everyone. There are some people who, right up until they're moving into transition, they feel like their contractions are no big deal. So that's why I encourage you to talk to your doctor specifically about you. But for the most part, living an hour away from the hospital with traffic, yeah, I understand that. That's how we were. That's an option to check into a hotel nearby when your contractions start. I can, because typically the time it takes for labor to progress, I wouldn't imagine that would be necessary, but that's definitely an option you can talk through with your partner, talk it through with your doctor. Think about if you think that's something that might be necessary. It might not be a bad idea, I guess, if you go to check in, but you could also try to check into the hospital if they turn you away. Go, walk around outside, hang out in the area, maybe enjoy a park. Of course, you probably wouldn't want to do that if it's late at night, so that could be a really nice option to have a hotel room on standby where you can go and feel comfortable laboring there without having to, risk exposure to other people. I think it helps that you've had a child before. Think about how your labor progressed the first time. How quick did it go the first time? We know more often than not it will progress quicker the second time. And if you did a birthing class before, should you do one again? That's kind of up to you. I think it's a wonderful refresher. There are a lot of people who will offer a second time class where it's a little bit more of a condensed version, a little bit more of a, they know that you've been there, you've done that before, so it's maybe not quite as basic, but still just a good refresher of things that you may have forgotten had happened before, or maybe you've forgotten more options. I think it's always just a nice idea, but totally up to you. If you want some online options, reach out to me. I can definitely send you some options, or we could even talk about maybe doing some one-on-one coaching, or maybe we do an abbreviated version for you just to make sure that you feel nice and prepared without having to actually go through a full birthing class. Totally up to you.
Yeah, so just a quick question. Can you hear me?
Yeah.
Okay, great. So obviously all the hospital visits are not happening right now, and childbirth classes are not happening right now.
Yeah.
Because they just can't guarantee safety. I actually hadn't planned on doing a birthing class. I feel like it'll cause me more anxiety in a way, because it's like I don't want to, go through all the steps and then, if something doesn't go right, So that's sort of how I feel. But do you think it's worthwhile to look into online resources? Like what? Yeah, I guess that's what I'm wondering.
Yeah, like I said, I don't think it hurts just to have that reminder of, what are all the options that are available to you, and to have that information kind of fresh in your mind of some different coping techniques. So I can definitely send you some options.
Okay.
Like I mentioned, I'm happy to do one-on-one coaching with anybody if you just want a refresher, and that way you don't have to worry about maybe digging deeper anywhere where you don't want to go,
it's my first, so it wouldn't be a refresher. It would be.
Oh, okay.
yeah, but no, still, but I yeah.
Yeah, if it's your first, then I say absolutely. Just because, like I mentioned earlier, sometimes we can feel unprepared because we run into a situation where we didn't know to ask that question.
Okay.
So I just think it can be hard sometimes with we can have a million wonderful resources around us. But for them, it's routine procedure, and they might just kind of forget that, like, oh yeah, this first time mom should probably be aware of this, should probably think of this, should probably dive deeper into this. So it can give you that blanket overview of, like, these are all the options that are available to you. Here are some things to think about. different coping techniques, different pain management options, different, what do those first 24 hours after birth look like? Just giving you kind of a different insight and preparation for what's to come. I think I can appreciate that fear of like, well, I don't want to know too much that it kind of impacts my ability to listen to my body and what it naturally wants to do. But I think sometimes when we take a really passive approach to our childbirth experience, we can kind of find ourselves in situations where we're feeling just a little bit unprepared. We have no idea what's going on around us. If somebody asks us to make a decision and we're like, well, I don't know, I've never thought about this before, and I'm in the middle of having a really difficult contraction, and I'm having a hard time communicating with you anyways, and now you're asking me to say something, and I'm not really sure. And so I think it can just kind of help to mitigate some of that. I would really highly encourage it before your first birth for sure.
Okay.
There's a lot of different options out there of what classes cover and what they look like, how long they are, how short they are. Do they really deep dive? Do they focus on non-medicated births? Do they focus on medicated births? There's a lot of different ways to run a class. So there's a lot of different options out there. So I would encourage you to take one and spend some time trying to find one that actually feels really good to you.
Okay.
But still, I'm here. I'm available if you want to do, if you feel more comfortable doing one-on-one coaching and doing something that's more specific to you. Totally happy to do that. You can shoot me.
Yeah, I mean, I think for now a lot of and sorry, I couldn't for some reason turn on my video, so probably we were talking to this. I guess, right now, because there's no in-person classes options, I am going to be looking into virtual options, for everyone, so myself included, safety. So if you do have any suggestions for that, or, if you're offering, I guess that's what I'm looking into then. Is virtual.
Yeah. I'll just include that in the email that I send out after this. There's a couple, virtual classes in particular, and then I am likely going to hold a small group virtual class where they still kind of get that interaction of talking to other people.
Okay.
And getting kind of that more one-on-one advice. But there's a few classes that are just like, you jump on self-paced and can kind of take yourself through it, at the time that you want, at the speed that you want. And I can send links to those for sure.
Okay, great. Perfect. Thank you.
Yeah. Any other last questions?
Can I just interject something real quick?
Yeah.
So I'm Kathy. I'm Rochelle's mom, and I'm a NICU nurse. And something that I've seen come up recently are people wanting to be induced at 37 weeks so that they can get in and out of the hospital before the curve hits the peak. And I've actually seen that backfire on people. At 37 weeks, your baby's lungs might not be completely mature, and you could actually end up, in fact, with a baby in the NICU, which is like something that is tremendously stressful on top of the stress that's already happening. So there are definitely reasons to have early induction, but if you are otherwise healthy and it's just based on COVID, I would encourage you to let your pregnancy progress naturally and wait till you go into labor. Obviously there's people that get, inductions that need to happen at 40 weeks or 41 weeks, but I would not encourage a 37-week induction.
Yeah, that's a great point. And it just kind of goes back to what we were talking about earlier, right? Don't make these drastic decisions based around fears around COVID-19. Make decisions based on maternal indications, based on fetal indications. It is what most care providers are doing and recommending right now anyways. Don't feel like you need to make these drastic last-minute changes or alterations to your birth preferences, to your childbirth strategy, just out of fear of COVID-19. We're just not seeing that that's necessary or really very beneficial right now. All right, I think we'll go ahead and wrap up. Like I said, don't hesitate to reach out to me if you think of additional questions, if you wanted to dive deeper, if there's any way that I can support you. I'll follow up with an email to everyone with some additional resources on the recording, and just to really appreciate you guys jumping on and taking the time to be here. So sending everyone well wishes and love, and it's going to be okay. I believe it, and have wonderful birth experiences, and I'm so excited for you all to meet your little ones. Hope you all have a wonderful day.